a few weeks ago, the International Myeloma Society did organize a specific meeting on the definition of cure. And that's really something totally new, in fact, for multiple myeloma. You know, in a lot of papers, a lot of articles, a lot of manuscripts, we are always writing myeloma is an incurable disease, and that's not true, you know. So it is time to think about differently about the outcome of patients with this disease. Why? Because we have now a lot of new agents, new drugs, and recently the development of new immunotherapies is very fast. And when we are combining, in fact, those new drugs together with autologous stem cell transplantation, etc., we have now incredible results in terms of a response to the disease, and long-term outcomes are really now improving. So can we speak about cure for all patients? Is it good to speak about cure in the relapse setting, for example? So we looked at a lot of database, a lot of clinical studies, and we did analyze the results of these studies with a very long follow-up. And we also have now the tools to look at the depth of response, the quality of response to a specific treatment. And we are calling this minimal residual disease assessment, MRD. And we know that there is a very strong correlation between MRD negativity, so we are not able to detect any myeloma cells, any tumor cells within the bone marrow. And most importantly, not only MRD negativity, but sustained MRD negativity. If we are doing sequential assessment of the disease within the bone marrow, and we are not seeing any abnormal tumor cells during a long period of time, maybe that could be the definition of cure. So we are now proposing a definition of cure. This definition is very simple, and that's a consensus between all the experts that were attending this meeting. The patient has to be out of treatment. He is not receiving any treatment, and he must be MRD negative during 5 years. So that's a very, very important point, because we need to stop the treatment. Someone that is receiving treatment during a long period of time or until disease progression, this is not cure. And also we need to have a very long follow-up to be sure that the disease is not coming back, in fact, after 1, 2 to 3 years. So how to achieve cure? And I mentioned this previously, we need to combine the classes of agents that are very active, if possible with autologous stem cell transplantation, an intensive treatment for younger patients. We are proposing autologous stem cell transplantation up to the age of 70 years. And after high-dose therapy, we can propose a maintenance with eventually 2 drugs, possible 2 years. So overall, we can have a treatment duration of 3 years, and then we are stopping the treatment and we are carefully following the patients. So what is the cure rate, in fact, the cure fraction? This is very, very difficult, in fact, to speak about this, because this rate is really depending on the drugs that we are using. And drug access is really key. You know that the reimbursement of drugs or combinations, the access to drugs is not, unfortunately, the same all over the world. You know, you have all the drugs available very quickly in the US, in Germany, and in Europe. We are fighting, you know, one country after the other, you know, for the reimbursement, etc. And the one drug or one combination can be approved by the European authorities, by EMA, but that's subsequently a country-per-country decision for reimbursement. And we know sometimes the time from the approval by EMA and the time to the reimbursement can take very long. It can be 2 years, 3 years, 4 years. So access is really key. But if we are combining now all the agents that we do have, we can expect to cure, and we are probably already curing something like 30%, 40% of young patients. We know also that with the same treatment, the cure rate will not be identical according to some characteristics of the disease. If you have a disease with, let's say, standard risk, I mean no cytogenetics abnormalities, the outcome will be much better. On the opposite, if you have poor cytogenetics, we know that it will be rather difficult not to reach a response, but to have the cure at the end of the day. So this is not that simple, and when we are speaking about with patients, we can give hope. Definitely, the most important word, to my opinion, is hope, because we are developing a lot of new agents, and they are becoming more and more effective, So with this clinical developments, with these new approvals, the outcome is really improving very, very fast. So in front of one patient, we cannot say, based on your clinical characteristics, based on your biology, you will be cured. No, we can say the probability of response is very high. The depth of response is very important. And if we can reach MRD negativity, therefore we can expect a very, very long overall survival for you, And we can also compare the outcome of myeloma patients with the outcome of the general population without the disease, with the same age. And now we are showing that we are close to reach the same remaining life expectancy. And this is also one way of curing patients. Your life expectancy will remain the same of the population without multiple myeloma. Obviously, you have to receive drugs. You have to, unfortunately, to experience some toxicity, some side effects. But at the end of the day, what we want to propose you is the same life expectancy as the general population without multiple myeloma.